Key Clinical Trials in Hypnotherapy and Trauma. Hello everyone, and welcome back. In our last lecture, we explored the functional imaging findings that show us what's happening in the brain and body during hypnosis. Today, we're turning to the evidence base, the key clinical trials that test whether hypnotherapy really works, especially in the context of trauma and related conditions. Clinical trials are essential because they move us beyond theory and brain scans to the real question: do people actually get better when hypnotherapy is used as part of treatment? Bryant et al., 2005-2006. Acute stress disorder and hypnosis. One landmark set of studies was conducted by Richard Bryant and colleagues in Australia. In these trials, individuals who had recently experienced traumatic events and developed acute stress disorder, or ASD, were randomized into three groups: cognitive behavioral therapy, CBT alone, CBT plus hypnosis, supportive counseling only. The results were striking. Both CBT and CBT plus hypnosis were superior to supportive counseling, but the CBT plus hypnosis group improved faster in the early stages of treatment. They had quicker reductions in intrusive memories and anxiety. Even more importantly, when researchers followed up 3 years later, those who had received CBT plus hypnosis maintained better long-term outcomes compared to CBT alone. This study suggests that hypnosis can act as a catalyst, speeding up progress and solidifying recovery. Abramowitz et al., 2008. Hypnosis versus zolpidem for PTSD insomnia. Another important trial was conducted by Abramowitz and colleagues in 2008. This one focused on combat veterans with chronic PTSD and insomnia. Participants were randomized to receive either hypnotherapy designed to improve sleep and reduce trauma symptoms, or zolpidem, a common sleep medication. What did they find? The hypnotherapy group showed not only better sleep quality, but also reductions in core PTSD symptoms. The medication group improved sleep in the short term, but did not see the same benefits for PTSD itself. This trial demonstrates that hypnotherapy can address both sleep disturbances and trauma symptoms simultaneously, offering an integrative approach where medication alone falls short. Arditte Hall et al., 2021. Sleep-directed hypnosis plus cognitive processing therapy. A more recent study by Arditte Hall and colleagues in 2021 took things further by combining hypnosis with cognitive processing therapy, CPT, for women with PTSD. In this trial, participants received sleep-directed hypnosis sessions prior to beginning CPT. The logic was this: many people with PTSD have disrupted sleep, and poor sleep interferes with learning and emotional processing in therapy. By using hypnosis to improve sleep first, the researchers hoped to prime the brain for more effective trauma-focused therapy. The results supported this idea. Women who received hypnosis showed faster improvement in sleep onset. They also had better outcomes for depression symptoms compared to those who received CPT without hypnosis. This study highlights an exciting direction, using hypnosis as a preparatory intervention that makes other therapies work better, pulling it together. Across these trials, we see a consistent theme. Hypnosis is rarely used as a standalone treatment. Instead, it acts as an enhancer, improving the speed, depth, or durability of evidence-based therapies like CBT or CPT. It also addresses symptoms that are sometimes resistant to traditional therapy, like sleep problems, nightmares, or physiological hyperarousal. While the sample sizes in these studies are modest, the findings are robust enough to show that hypnotherapy is more than placebo. It has measurable, lasting effects, especially when thoughtfully integrated into broader treatment plans. Key takeaways. So, to summarize today's lecture, Bryant et al., 2005-2006. CBT plus hypnosis led to faster symptom reduction and sustained benefit at 3 years for acute stress disorder. Abramowitz et al., 2008. Hypnosis outperformed zolpidem for PTSD-related insomnia, improving both sleep and trauma symptoms. Arditte Hall et al., 2021. Sleep-focused hypnosis before CPT improved sleep onset and depression outcomes in women with PTSD. Overall, hypnosis works best as an adjunctive therapy, enhancing existing treatments and addressing stubborn symptoms. In our next lecture, we'll zoom out and look at the broader clinical evidence and meta-analyses. Instead of single trials, we'll examine what happens when researchers pool dozens of studies together to see the bigger picture of hypnosis across PTSD, anxiety, depression, pain, and psychosomatic conditions.